Hi, Professor. This is the Social Emotional Development PLC oral presentation, and my name is Lydia. My group members are Dane, Tamana, Vanessa, Michaela, and Lanisha. Michaela will give us the mission statement.
Our mission statement is as follows. By focusing on the external factors that affect the social and emotional mental health of children, we can identify the negative factors and work to establish programs to assist in the transition from those hardships to a healthy mental state. We'll focus on the following specific interests: prenatal dispositions, unhealthy relationships, violence, family life, therapy, complete adolescent stage, and emotions. We'll be focusing on Erikson's psychosocial stages when discussing our specific topics. The 8 stages are as follows: infancy, which goes from birth to 18 months of age, and it focuses on the outcome of hope. Early childhood goes from 2 to 3 years old with the outcome of will. Preschool goes from 3 to 5 years old with the outcome of purpose. School age goes from 6 to 11 years old with the outcome of confidence. Adolescence, 12 to 18 years of age, with the outcome of fidelity. Young adulthood, 19 to 40 years of age, with the outcome of love. Middle adulthood, 40 to 65 years of age, with the outcome of care. And maturity, with that goes from 65 to death, which the outcome is of wisdom. We also cited our picture here, and this is just a little visual of the stages of Erikson's psychosocial stages. And now Lydia will continue on with her specific research.
The title of my research is Impact of Perinatal Depression on Socio-Emotional Development of Children. Perinatal depression occurs during pregnancy. It's usually caused by a number of factors, which could include fear of raising a child, uncertainty about the health of the unborn child, and economic factors. My hypothesis is perinatal depression causes socio-emotional development problems. Perinatal depression has an impact on socio-emotional development of the child because children are dependent on their caregivers for consistency of care. And according to Erikson, this is the trust versus mistrust psychosocial stage. And during this stage, according to what the mother provides to the child can have the outcome of hope or mistrust. So it's very important for the mother to be in a normal mental health state, for her to guide the child through this stage and for the child to transition successfully. This period coincides with the period of substantial brain development of the child. Children have brains like sponges, and they suck in whatever is in the environment, whether it's positive or negative. So whatever the caregivers provide for the child, that's what the child will take in, which ultimately affects the social emotional development. The study followed up pregnant mothers up until 2 years postpartum, and the study found that perinatal depression increased the risk of social emotional development issues among children. Later on in life, these issues manifest as aggressiveness, social withdrawal, and learning difficulties. Perinatal depression is something that has to be looked into and taken seriously because the study looked at children and pregnant mothers, but then you can see that the outcomes are manifesting even in adulthood, which means it affects the child's general life outcomes. And as a way forward, it should be mandatory to screen mothers for depression during pregnancy and appropriate measures taken immediately. As a nurse, I'll ensure that mothers know the importance of good mental health during pregnancy and that it affects the social emotional development of the unborn child.
So my topic is on unhealthy relationships. So I focused on Erikson's 5th stage of adolescence, identity versus role confusion. Identity versus role confusion is a stage where adolescents explore their independence and develop like a sense of self, where they find who they are. unhealthy relationships can affect that by destroying your identity and making you believe things that are not true about yourself. And so how can unhealthy relationships affect you? Um, so it can affect you by lowering your self-esteem. It can give you anxiety. It can give you depression and other factors that are not mentioned on here, like doing poorly in school, or reporting to binge drinking, attempting suicide, or physical fighting. So overall, it adds high stresses at a young age that can impact your relationships with family, friends, education, and work. Um, so abusive partners can leave you feeling confused about what is expected of you and who you are as a person. In an article that I read, called Links of Adolescence Identity Development and Relationship with Peers, a systematic literature review, Regulin mentioned in the ages of 12 to 18, adolescents construct their own unique sense of identity and find the social environment where they can belong to and create meaningful relationships with other people. This period of time will typically create a foundation for adulthood. So it's important to maintain healthy relationships and carry them on in life. So connecting it to my career path, going into nursing, it's important for me to maintain a healthy development to ensure positive influence for patients that will be soon to be cared for. It's also important for me to make accurate evaluations of other to prevent the unhealthy relationships from continuing. Um, and by doing that, also spreading awareness about this issue.
And I will be discussing how violence in children has a direct correlation to the exposure to violence within their childhood. So, when a child grows up in a violent family where maybe abuse occurs between the father and the mother, or maybe even the child is abused, their exposure to violence leads to many unfortunate things that we see in a lot of children today, including underdeveloped understanding of their emotions during the transition from middle childhood to adolescence. And this causes children to not fully understand how to express their emotions, how to express their frustration and anger and sadness. So, because of this, children use perhaps violence or aggression as an outlet to express those emotions that they cannot otherwise express. This happens a lot, and we see it in bullies coming up in from third grade all the way until they're 18 through high school. We see somebody who doesn't know how to express their emotions, and they fixate on another child who is maybe weaker or is able to express their emotions, and they take it all out, and it ends up being focused on that one person or multiple individuals who become sort of their prey. And that's where the violence and aggression is taken out. There are easy protective measures that can be taken to protect these children throughout their social emotional development that just take some awareness, and we can get ahead of the problem. Some of these protective measures include a mandatory 6-month screening in schools. We can have it where children meet with their counselor at the beginning of the school year, and then also maybe right before summer vacation starts. That way, a trained counselor can kind of see and try to get those early signs and can maybe give that child help and prevent them from going through the difficult and cyclical process of having violence as a main focus in their life. Another option is training teachers and administrators on how to identify these signs and how to address it with the child or maybe their family in a way that isn't going to make them feel like they're in trouble or feel like they're being attacked, but more so in a way that help is offered and they're given references to care and maybe therapy, something that will end up benefiting them. And then another possible way is having emotional screening part of health checkups with their primary care doctors. Oftentimes school sports and athletics or even trips require a child to get a physical. If we make a quick little 3-question screening that doctors ask their patients, they can see the signs and again, get ahead of the main problem. Considering I'll be going into a path of psychology, hopefully getting my MFCC Marriage Family Court Counseling license, it'll be important for me to be able to know the signs, and other counselors to know the signs, so that you're not tricked by a facade of a peaceful and whatever household and this child is just acting up. No, we have to understand that that child is acting up for a reason. Maybe they have no other way. So we have to know the signs, and we have to be able to get them resources, and getting them resources at a time and manner before they're getting older at the youngest possible stage will enable us to get rid of those bullies, help these children who are desperately in need of it.
I will be discussing family life, where I will focus on child abuse and neglect. Dysfunctional families can lead to child abuse and neglect, which can affect an individual in many ways that can have long-term impacts on both mental and physical health. Child abuse can include physical abuse, emotional abuse, sexual abuse, and neglect. As the CDC article states, physical abuse is the intentional use of physical force that can result in physical injury. Examples include hitting, kicking, shaking, burning, or other shows of force against a child. Keep in mind that many cultures around the world view physical different from others. Emotional abuse refers to behaviors that harm a child's self-worth or emotional well-being. Examples include name-calling, shaming, rejecting, withholding love, and threatening. Risk factor for depression, anxiety, and other psychiatric disorders throughout adulthood. Sexual abuse involves pressuring or forcing a child to engage in sexual acts. It includes behaviors such as fondling, penetration, and exposing a child to other sexual activities. Neglect is the failure to meet a child's basic physical and emotional needs. These needs include housing, food, clothing, education, access to medical care, and having feelings validated and appropriately responded to. According to Erikson's theory of psychosocial development, children who are abused come from many different family dynamics and can be abused at any age. Study found that children can, if stopped in time, limit its long-term consequences if help is given. By reducing the incidence of child abuse and neglect through primary prevention approaches and providing comprehensive trauma-informed care when it does occur. In trauma-informed care, service professionals acknowledge a child's history of trauma and how that trauma can have an impact on the symptoms or consequences being experienced by the child. Communities can act to stem the effects of maltreatment and even prevent it. There are a number of agencies that can work with families and communities to spearhead initiatives that build upon strengths and address needs. Connecting this to my career path as a healthcare provider as a dental hygienist, I will be obligated to report and call CPS if there are any signs of abuse at home.
I decided to focus on therapists and client emotional expressions during psychotherapy and the outcomes of it. Psychotherapy is substantially more effective and significantly a different process when the therapist and the client engage in expression of emotional arousal. Emotions serve a survival purpose in giving information about personal, meaningful situations. A productive therapy session can help train the client in expressing and experiencing emotions themselves. Clients can include all age ranges where they can be impacted by the emotional arousal during therapy, and they can gain more emotional intelligence and expression than therapists, though more outcome is preferred for the client as they are the one with the health plan. Clients who participate in emotional arousal have more salient cues that therapists should know how to attend to and respond to. All these studies were not in a controlled environment, but some have observers affecting the results. So no one is sure how the effect of emotional arousal is in a randomized regular environment. This finding can affect 7 stages of Erickson's 8 stages of psychological development for early childhood to maternity. All those except for infancy may not be able to comprehend some of the therapy and emotional arousal. With my career path and knowing this information, I'll be able to speak with clients in a way that'll help them and make activities that are more emotional arousing and be able to read the salient cues that they give off.
So my topic was the importance of a complete stage of adolescence. And adolescence is the 5th stage in Erickson's list of psychosocial stages. And it's defined by identity versus role confusion, because in this time, the child or teenager, they're trying to figure out who they are and where they fit in society. And adolescence is a really important stage of human development because this is the transitional phase between childhood and adulthood. You come into adolescence as a child and you come out as an adult. And during this stage, the adolescent is starting to figure out who they are and what the kind of person they want to be, both identity-wise and professionally. And obviously, you're going to see physical changes in this stage, but the most important are the mental changes. For example, adolescents develop a sense of invulnerability, which can lead them to making bad decisions. Also, during this stage, adolescents, they stop seeing everything as black and white as children tend to do, and they strive to become more and more dependent away from their parents. Most importantly for this stage is for the adolescent to grow and mature in a stable, healthy environment. With that in mind, a complete and healthy adolescence can lead to a potentially stable adulthood. And my connection to my career path as a nurse, it is my job to provide a safe, healthy environment, both physically and mentally, not only for adolescents, but for people of all ages.
And here we have a couple group members who unfortunately were unable to participate in our presentation, Mina and Dakota. This is where their information would have been. And to close, we have our bibliography citing all of our research papers where we found the information. And lastly, the image that was shown in slide 3. Please feel free to ask us any questions. Unfortunately, we don't have an actual audience, but should they have been here, this is where questions would be. Thank you all for listening. How do I stop recording this?